I did.
And that's
Well,
Jim
because I
Slater.
was looking at the lights, but only one of them's lit.
Okay, well, we'll get the other one
Had
lit
me
up here
worried.
shortly.
I don't
It
know what
wouldn't
those
light up.
lights
There we
are,
go.
but I know that every time they're on, I have to watch my language.
Okay,
So-
well, let's get another one turned on here
Oh,
too.
now we have two.
Now
That
we got
means
two lights turned on. We're going to have a third one, I guess, turned on here.
We are live.
So all of our lights are on. Once again, welcome to Veterans Talk, The Forgotten Promise, streaming live from Las Vegas, Nevada at the VTRC studio. And that was Jim Slater, my favorite author.
Well, I thank you very much for that. I like to wish everybody faith, courage, and enthusiasm.
And sitting in between us is a registered nurse, also operating room registered nurse, and that is Helen French. And she's going to have quite a story for us. But before we get started, I do want to say happy birthday to my service, the Air Force.
No, wait a minute.
Happy birthday.
Took the blue from the sky and the pretty girl's eyes and a touch of old glory too. And we gave it to the ones that proudly wear the U.S. Air Force.
Keep
blue.
the day job, Jim.
Okay.
Also, yesterday was POW MIA Day. So just want to make a comment on those things and hope everybody has been recognized on those days for all that they have done for the country.
Yes,
And
absolutely.
now we're going to get started with Helen. This is a little bit different kind of show, and the reason we brought Helen on, because number one, she has the medical expertise, but also she has the experience of something that happened with her spouse, actually, that we want to talk about. And she went deep into this. I mean, she went into the CFR, the Code of Federal Regulations. That's what CFR stands for. And it's 38 CFR dot whatever that governs the Department of Veterans Affairs. And these are laws, folks. And in particular, the law says that the VA will have on staff an ophthalmologist. And I'm going to turn to you, Helen, because I want you to explain the difference between an optometrist and an ophthalmologist, because that's
Okay.
very important into the story that you're going to share with us.
That's correct. Thank you for having me here today, and good morning, everybody. My name is Helen M. French, and I always put the middle initial in there because my pharmacist says there's 10 other Helen Frenches around. So I am the only one, and I speak very directly about everything. I've been a nurse for a long time at a trauma level 1 hospital, and I've always taken my patient care seriously. And the point being, as to what happened to my husband, is truly, to me, was horrific. I am still upset. I'm still having nightmares about what could have happened to my husband. And I'm not a person that gets excited very easily. I'm very cool in all situations, in the medical arena, operating room arena, etc. The point of it is, a lot of people do not realize that, as RJ mentioned, that there are regs. There is a federal reg, and he mentioned it, and it's 38 CFR/1738. And this says there is to be an ophthalmologist present in all eye clinics. The day my husband started having some unusual symptoms at home, my first impression was, oh my God, it has to be an allergy because nothing else fits the scenario. And what happened was that one of let me start the ABC. He went from using a cane to needing to use a walker because he fell a couple times. And then he ended up in a wheelchair by the time we got to the VA system there in the Southern Health District off of Pecos. What happened was that I kept telling my husband, something's wrong. I know your eyes are burning and they're weepy and they're this and that, and he couldn't stand the pain. And as a nurse, I didn't have any tetracaine, which is a numbing solution that they use in eye cases, or anything to help him. So we were using compresses on him, warm compresses, etc. Finally, I said, we're going into the ER. I said, something, I know at least I don't know for sure, but I think my impression is right, that you're having an allergic reaction to something. And nowadays, who knows what? There's so many types of foods, et cetera, medicines, whatever, latex gloves. I mean, there's allergies everywhere throughout the world that people can have a anaphylactic shock, not just shock, which is it's the same thing as anaphylactic shock. It's just the end result of a shock. You'll die, and it takes less than 5 minutes to die. So when I took him in to the VA there, and we started with the ER, and I explained the situation. My husband, like all vets that I've met during my time here, as I was a volunteer at the VA, I mean, they're macho men. You know, they don't like to say, "Oh, I'm hurting," or this and that. At least that's the ones I know. At least that's the way my husband is. Anyway, what happened? Unbalance, the et cetera, all these other issues were sort of like disregarded because his eyes was causing him so much pain, and that's what the focus was on them. And the doctor said, "Oh, well, it looks like pink eye to me." And I said, "Sir, respectfully, you're a doctor, I'm just a nurse, but respectfully, I've been a nurse for a long time. I've been on an ophthalmology team at a trauma level 1 hospital, even besides everything else. And I'm a mother, grandmother, and even a great-grandmother. And I know what pink eye is." So he looked at me and he says, no matter what is or what isn't right this second, let me just get you over to the eye clinic. So there's my husband in a wheelchair, and we're going over to the eye clinic. When we got to the eye clinic, which worked us into the schedule, thank goodness. We waited and waited, and when I wait anywhere, I talk to people. I consider all my people patients, and I was one that all needless issues to patients are just needless and just sad to me. I'm that type of person. I have compassion. Anyway, he was finally seen by somebody, and I'm not going to mention gender, names or whatever, but I wrote everything down. And this person said, well, okay, everything looks okay, da-da-da-da-da. Basically, that's it. Gave us some ointments to put in his eye. We were told to come back again in 2 days. So we met another person there, and et cetera, et cetera. And one of my complaints was, hey, some of these ointments you gave me would only last like 2 applications to the eye. What's with that? It's a little tiny tube of 1 cc or 1 ml or whatever. And then we were told to come back in another day. Well, by the 3rd time, I've been researching federal sites, and I saw all who examined my husband. And I said to my husband, I said, this is not right. This is not right. When anybody has anything wrong with them, and most vets already have complex histories, medical histories, medication histories, et cetera, et cetera. I said, this is not right. And my husband doesn't like to cause any kind of commotion. I says, I'm just upset. So then we came back to the last optometrist. I pushed my husband onto the exam chair in the exam room and put his wheelchair outside. And I walked in, and this optometrist, who said he had a PhD, et cetera, he's 28 years there. And let me tell you, PhD, I don't care if you have 10 PhDs. If you're not medically trained, I don't care what you have. Nobody touches me or anybody else or my patients if you're not medically trained. Well, he was saying to my husband, are you feeling a little better? Well, this was like, 4th time or so? And my husband said, maybe a little, thinking about maybe the ointments that had been prescribed. And he says, well, you better get used to it. And I ranted. I came in. I said, excuse me? My husband's a veteran from Antique days, back years ago, and he's been faithful ever since, et cetera, et cetera. And my God, you're not giving him any hope? You don't even know really what his diagnosis is yet, and you're telling him he better get used to it? I said, my God, what do you mean used to it? Used to what? Well, I went on, and finally the optometrist said, well, you've ranted for 20 minutes. It's my turn. Well, I said, nope, I said, my husband needs a referral to a medical doctor. Medical doctors, as different medical doctors, and especially ophthalmologists, oh my God, they go to college, they go to medical school, they go to residency, and then they take specialty courses. And somebody, if they're not just an ophthalmologist slash, if they go on to become an internalist, I'm sorry, I'm sort of.
Let me do this. We've talked about a number of things that I'd like to draw out and get a little clarification for the listeners, if I might.
Thank you. Thank you.
An ophthalmologist compared to an optometrist. An optometrist provides eye care, they do eye exams, they prescribe glasses, contact lenses, and they can diagnose common eye conditions. But an ophthalmologist is a medical doctor specializing in advanced eye care and surgery, and they're capable of treating advanced
Everything,
eye things.
yeah.
So the ophthalmologist is the person you go see to get your glasses, and optometrist for the eyeglasses, ophthalmologist for eye care for disease of the eye.
Amen.
And-
That's sort of a synopsis right there. The point being is, very few people know what an optometrist education is versus a medical doctor's education. Optometrist, and I have it from I wrote down a lot, or I've copied from the internet, their education. Some of the optometrists go to 4 years of college, and then they go to optometry school. Some just go to optometry school, and some who knows what. The point of it is, I believe, being an OR nurse for decades, that patients, all patients, not just my veterans, need to be seen and diagnosed first by a doctor, a medical doctor. And when he wasn't, I just thought, my God, this is substandard care. And then, anyway.
Well, let me throw this in here.
Go ahead.
As you pointed out, an optometrist is quite different. As Jim read their description of each one, you needed to see an ophthalmologist to actually look at this versus an optometrist. And as you pointed out, in the 38 CFR, Code of Federal Regulations, whatever, says that the VA needs to have an ophthalmologist on staff.
Exactly.
And
exactly.
evidently our hospital, not because you were referred downtown.
I'm
Is that correct?
sorry.
You were referred downtown to an ophthalmologist?
I demanded. I didn't ask. I demanded. And let me read this. This is from the internet. There's a lot of descriptions of optometrists and their education and training. And all optometrists must complete a Doctor of Optometry, known as OD. A lot of people don't know that. They don't know that, and again, I have nothing against optometrists, chiropractors, whatever. A lot of people have titles of doctor, but they're not medical doctors, and people don't realize it. When somebody comes in and says, I'm Dr. such and such, right away, most people, from what I've seen and heard, they think they're a medical doctor. Okay, this professional degree trains you to diagnose and treat refractive errors, basically. That means glasses. I don't know what else somebody's doing somewhere else in some other states, but that's another story. According to one of the EDU sites, the school educational site,
Right.
whatever, an OD alone does not qualify you to diagnose or treat eye disease. This is written to the OD students. If any of your patients display signs of eye disease, you will need to refer them to an ophthalmologist for further care. And that's when I found out that he was not being seen by ophthalmologists and getting stuff that later on I found out that was probably her. The ophthalmologist mentioned, hey, Helen, no. All these lubricants, no, not in his case, no. The final thing was we finally got, to see
You
a
finally
doctor.
got to see the right person.
We went to my husband's neurologist there. I'm not, going against any of his HIPAA rights or anything like that. He's given me permission to speak for him. My God, when he finally got to see the neurologist, a medical doctor with lots of education and degrees and sharp as a whip. Oh my gosh, you know, and I know I can tell somebody who's intelligent right away when they're speaking as a doctor. They looked at all his Parkinson's medications and he honed it down to 2 that were probably the culprit in causing him to be off balance, to have pain, to fall, to all this, and then to, you know, his eyes. I thought, oh my God, his eyes. To me, eyes are precious because in surgery, you can do almost anything with any part of the body, cut apart, and then approximate and suture it up, staple it up, whatever, and you're fine. With an eye, if somebody goes into an eye that doesn't know what they're doing or giving you wrong medication for that eye, you could destroy it. The eye has 2 chambers, an anterior and posterior. Interior is it's called aqueous humor, and posterior is called vitreous humor. If somebody messes with an eye at all, most people will go blind or have a detached retina maybe first and then blind. But the point of it is there's so many complications, and eyes seem so simple, that somebody could just develop because of not being seen by a medical doctor. Again, they are ODs, they're called, doctors of optometry.
Right.
But ophthalmologist is ophthalmologist /
Is the
internal.
medical training. I'm going to stop you there for a second because I want to refer people back to a show we did about 2 months ago. We had actually a Army veteran who happened to be an anesthesiologist suffering from macular degeneration, and we had his retina specialist on with us, Dr. Russell Jane, and you can tell from listening to their story that as the veteran, even though he was an anesthesiologist, as a veteran though, he was very stubborn to give in to say, I've got a problem with my eyes. But he did finally get the proper care because his training told him, I need to get, you know, professional care. And he went straight to the right kind of person for that care. And I encourage veterans, if you're having problems like this, and they send you to an optometrist, you need to do, we call it the homework. You need to do the homework and make sure that you're going to see the right kind of provider. If they, for example, if I had a high PSA, everybody relates that to prostate cancer. If I had a high PSA, you wouldn't send me to just a medical doctor or a urologist. You may want to send me to an oncologist who specializes in different types of cancers, and they can interpret what a high PSA means. And that's what I'm getting at. You need to be more aware of your care because it's your body. And I'm going to go in. I'm going to start rambling on you here, but go ahead, and then I'm going to go give another example.
Okay, thank you. The point too is that needs to be brought out. Since community referral care was put into place, how do you know who is who out there in the community that is being referred to an optometrist and not to an ophthalmologist? And that's scary because, again, eyes are precious, just like you were talking about the anesthesiologist. My God, that's his job, to be able to see the medicines and doing the spinal, this and that. Eyesight, I mean, you can't be a helicopter per se, you know, helicopter. You have to pardon me, people out there in the audience. The vets everybody needs to do their homework, and they're correct. But the way things are written on the internet, they make things complex. And the most complex things are like on PubMed, JAMA, or Medline, all this. But you need to know just the simplest thing. What is best for you? And go for it and demand it. Go ahead. I had to say that, and I just...
All right. Well, let me give the other example I was talking about. We talked about everybody's body being different, and that's why you said you don't want to tell the medications that your husband was allergic to because everybody's body is different,
and
extremely different.
I had violent reactions to statins.
Yeah.
2 different types of statins. They dizzy, knocked me down. It was so horrible. And that was 1 pill each.
Yeah.
And right away I said, I can't take that.
And may I interrupt? And so many people nowadays, especially what I see in the within the veteran arena, they're on a lot of medications. So you never know which one is causing you problems.
Yeah.
And then, so you need to start with being diagnosed first by a medical doctor. And if they're not any good, go to another medical doctor. You know, you have to demand excellence. It's not, you know, you guys, you dealt with lives for years, right?
Yeah.
Work, you know, in all the different military services. Oh my gosh. It is our time to demand that all the VAs do the same. And then, horrifically, I found out that Nevada doesn't have any ophthalmologists in any of the states. They are not, or any of the
They're
area.
non-compliant with the CFR. They're breaking the law.
And there's other states that are not compliant. So this is just not my husband's issue. It's your issue. It's all other veterans' issues. I was talking to a Native Indian who was a former federal judge about all this stuff. And she says, Wyoming's not compliant. She knows North Dakota, South Dakota, whatever. I go to UCLA for my eye cancer. And that's another problem. But I have the best. I get platinum care there at UCLA with my eye cancer. I am blind in my left eye. And doggone, you know, I didn't even have to demand it. They just did it. California's compliant. Pennsylvania's compliant. I don't have the energy or the vision, or good vision, to go through all 50 states, you know, what is what. And I'll just add something here that just really, really upset me. I called, and I hope somebody calls him, Congressman Bost, B-O-S-T, out of Illinois, his office in 202. I don't deal with the offices, local offices, and that's another story. The point of it is, I wanted to talk to him because he's the chairman of the Veteran Affairs type of stuff. And he's got a lot of Republicans on it, a lot of Democrats on it, which is it's the way it should be. But people don't have any idea what's going on and how hard it is to get, to call somebody and get some reaction. I have written people here, legislators in the state, and again, I knew better because that's, you know, I never got replies from them. The point of it is, the federal law is a law. I don't care if COVID-19 happens again, or if we have a national flood or national, the federal law is a federal law and it needs to be followed. And people know it's not being followed. And that's what's really just irritating to me.
I could follow up on that just for a second.
Okay.
We've talked about CFR, the Code of Federal Regulations. Number 38, CFR's 38, deals with the VA medical treatment. Now, if you want to look things up, go for it, but understand that CFR 38, Part 17, goes from 17.1 to over 17.93.
Yes,
So
yes.
the CFR,
Yes.
the
It's a
Code
very
of
long
Federal
law.
Regulations, it's very complicated, very long. It's kind of divided out so you can find stuff, but it's hard to find. But it's there.
And it's a law. It's a
It's a
law.
law, and it's not a secret. So if you want to go look up the Code of Federal Regulations, CFR 38, you can find all that information in there.
And it's not easy. And it's not easy. And I just have to give you an example from the operating room arena where I've been a passionate patient advocate for patients. I have thousands of articles, research, just stories sent to me, things I've documented. These are all, most of them are all litigated. But for example, this doctor, for example, and I'm not pointing out the issue that he's a doctor, but the issue behind it. There was a doctor in Texas that just got put into jail for 30-some years or so. Anyway, the point of it is, he had a PhD in neurobacs. And this is all valid. This is all in court filings. He paralyzed over 33 of his back patients and contributed to their demise. And this, it comes down to his team was saying later, oh, we knew he didn't even know his anatomy. And then the hospital was quoted, and again, this is all down in writing, and the hospital said, oh, we just didn't want to get involved. And I said, and this is how I feel here. When somebody knows there's a law, I don't care who it is or who went or whatever, some leaders, all leaders all managers in their role need to make sure that this law is followed, not change because of situational stuff. But
And unfortunately, you pointed out something very specific. Obviously, if this guy was a specialist, I'll say he got through the cracks
yes,
and didn't know what he was doing. His staff said,
Allegedly
Yeah.
didn't know what he was doing.
Right,
allegedly
yeah,
didn't know
but
what he was
yeah,
doing.
yeah,
But his
yeah.
staff said that's
Right.
what they testified to.
But my
But-
feeling was when you know something's wrong, you know what to do, you do it. You know, I don't. It shouldn't take somebody in Doge or President Trump or anybody saying do it. You do it. You know, when my husband flew a helicopter, and his helicopter's in the Smithsonian, what do you call it, aeronautical place, they're in D.C. When, you know, they follow rules, A, B, C, you do this and this, you check and make sure everything's right. And you don't take off until you know things are right. But you do it, so there's no fatalities. And that's just a simple synopsis or a simple example. But to me, life is precious.
It is.
And nobody should be messing with it.
RJ, you had a
Yeah,
sample?
well, I wanted to bring this back up, and I went to an example before that Helen pointed out, that everybody's body is different. And this is a true story about a lady from Missouri who was accused and jailed for killing her child.
Oh, my God.
And because they found a glycol-type substance in the autopsy. And after spending 2 years in jail, she was pregnant when she went to jail. She had a baby while in jail, and that baby was under very strict observation.
Sure.
So, and she had no access to glycol at all.
Right.
And all of a sudden, this baby started showing signs of glycol poisoning.
Oh, my God.
And this lady's been in jail, and the baby no way got it, but there was a rare condition that existed where your body actually produces a glycol type substance, and it killed her first child, and without the intervention it would have killed her second child, and she was jailed for this. And it disturbs me that she should have never gone to jail in the first place. They should have been more thorough in finding out the reason why the glycol was in there. How was it put in, how did it get into the child's system, in other words? And they did not do that. And that's what an autopsy is supposed to
Okay.
provide.
You mentioned autopsy. Autopsies used to be paid if there was a death at a home. This is nationwide. If somebody died at home, they usually did an autopsy, free. Whoever picked the patient up or deceased person and took him to the hospital. The autopsies used to be free. Now, autopsies have to be paid for by the family, but you usually have to go through the lawyer to get that autopsy, and then the family has to pay for it nowadays. And the issue is there, how many vets, and I'll give you one example, and again I can give you hundreds. Not even about a year ago in West Virginia, vets over 12 died because of something they didn't know. Here, a couple of the families kept pushing this situation and the issue. They wanted to know what's going on. Come to find out, there was an RN there injecting veterans in this veteran home, with insulin, and they were not diabetic, so they all passed. Now they dug up bunch of the bodies, of these 12 or more, and they confirmed everything, that this was her, that this RN did it. So again, who the heck would have the opportunity? Again, there's no leadership in that pharmacy, who was checking the meds that she was given to anybody, or why do they trust her? Again, it just makes me so sad to hear about patients in general, but your vets just dying, and they would have never known if they didn't do an autopsy. And
And
autopsy
we've said
showed
this-
it was insulin
And we've
overdose.
said this before, that trust should be a four-letter word, because it's something that we all need to look at, and we don't talk enough about it. But you think about the number of people that you trust, especially in the VA healthcare system. It's not just your doctor, and I pointed this out when I had Dr. Jane on. Medical doctors, they got a lot of stuff upstairs, and trying to sort through it all and remember it all. I mean, computers makes it easier, but The newer doctors don't have that experience. They
Amen.
just go
Amen.
to the computer and say, "Oh, we give them this and this and this," and
I agree. And you know what? People forget that, yeah, AI might be great, and it is probably in certain situations, and I'm not going to even go into that. But the point of it is the information going into medical, quote unquote, AI has to be programmed by somebody else. And if that somebody else doesn't know what they're doing, that new doctor that's coming out here in Nevada or anywhere else, they'll get the wrong information, or the patient will get the wrong information. So you have to, like you were saying, it's a shame, but you have to watch out for yourself, or your husband, or your wife, or
I can give you an example for myself. When I was on active duty, I was given a drug. It was called Ascriptin. I don't know if you're familiar with it or not, but it's a combination aspirin and something there to settle your stomach so the aspirin isn't too hard on it. But I was way, way overdosed. It said like take 1 every 4 hours or 2 every 4 hours. I can't remember. It's been that long ago. But I was overdosing, and I mean, I started having a headache out of this world. I started seeing double. I had some other issues, and I went to the doctor and went back to the pharmacy and said, I think there's something wrong. And fortunately, my mother was a nurse, so I happened to have an old PDR at home, which a PDR
love
is a
'em. I love
physician's
'em.
desk reference, and it is a physical book. It was about yay thick.
Yep.
And I looked up that medication, and I started seeing the contraindications and such on there, and I'm going, oh my God, I'm taking too much of this. And that's when I went back to the pharmacy and said, hey, you got the dosage wrong on here. Are you sure this is what the doctor sent down?
Yeah.
Somebody made a mistake in there. And
Amen.
Can
That can
I
happen.
point to the doctor? Maybe he just got confused in his head and wrote it down wrong. Or I always love to tease the doctors, because I said, did you take a very special class in ancient hieroglyphics on how to write prescriptions? Because
Yep.
I swear, I've seen a lot of prescriptions in my day, and I know you've seen a whole lot of prescriptions. Can you read them?
No, and that's why the electronic stuff is good, because it dates it, times it, this, that, and whatever, and you do your electronic signature, because then anybody can use his information or his orders. But before I forget, and just to the public, if you take aspirin, I love aspirin. I don't take it. Well, wait a minute. I should clear that up. I take 1 baby aspirin a day per my heart doctor, but it should be enteric-coated, not aspirin. Aspirin is great. Like if you're having a heart attack, aspirin will prevent the clots and this and that. You sit the patient up and get them into the hospital. Aspirin should only be enteric-coated, meaning it takes a while to digest. Otherwise, it causes inflammation of the stomach, et cetera, et cetera. So again, you just mentioned all these things that patients need to be aware of. But again, when a vet maybe is experiencing PTSD or trying to find a job, et cetera, or being counseled at one of the psych clinics, let me tell you, I've spent a lot of time since 2017 knowing the vets and their system. I went, especially off of Stephanie Street, where I would talk to them. The vets shouldn't have to worry about all those little things like that. That is this too much or whatever? Is this prescription right? And
Unfortunately, we have to worry about those things.
I know.
Because it's our body that's being affected.
Amen.
Once again, I know it's a big, long list of stuff that you get. You get that prescription in the mail, and you come out with pages.
Amen.
This,
Yep.
and this, and this.
Yep.
And it's a lot of stuff to read, but the things that you need to look for is the things that allergies, contraindications,
You have
the basics.
And you have simple stuff like, should you take it with food or not food?
Amen.
On an empty
Yeah.
stomach, can you eat right afterwards? Do you eat before?
Right.
All of that has to do with the strength of the
Yeah.
medicine you're taking.
And
in your
I can
body.
think of one offhand, and it's the like Boniva, and I can't think the other one for what am I thinking of? Anyway, you take it. It's for osteopenia and osteoporosis.
Okay.
That
I'm
you
not-
take it and you have to sit upright for at least 30 minutes. Otherwise, it will go back in your stomach, and I guess it goes back in towards your
Well, it
esophagus.
can even
and
erode
that's
your
it.
esophagus
Yeah.
going down. And then as it sits in the stomach with nothing there, no saltine or something, it will cause an ulcer. And if it's the ulcer's cause happens to be right over an artery or vein, you're going to bleed out right away. Yeah. I don't. There's so much that can be changed, but it needs to be changed by good leaders.
Well,
And people that, again,
I'm going to point out
compassionate.
it's the veteran themselves. That's all part of homework that we
Yes,
stress on
yes.
this show from A to Z. We always come to D and says, do your homework when you get a new medication. Look and make sure your other medications don't interfere with it. Simple as that. I mean, some of the stuff they send you with the chemical breakdowns and all, you don't need to know that, but you need to know the effects on you, the counterindications, anything else that you can understand that may affect your health. These are the things you need to look for in the whole gobbledygook piece of paper that you get from the VA.
Amen. But again, when you have a list of medications, and then you go through all the side effects on each medication, it is confusing as hell. I will just say it. It's just, again, I like somebody to be fastidious and precise and compassionate. And I just feel like the VA has failed in some of these, and I've seen other things, but I'm not going to mention them. But you want to talk about the shock?
You're following along with the show. We know that Helen took her husband, the veteran, to the VA because he was feeling weak, he was feeling dizzy, his eyes hurt. The doctor looked at him in the ER and he said, "Oh, you have pink eye." So they sent her to an optometrist who's not a medical doctor, and they gave him drops, but they didn't give him enough drops. Then they go back and nothing ceased. Said, "How do you feel better?" He really doesn't feel any better. He's not getting better.
And then the
Right?
drops were not appropriate.
And
The
the drops-
gels were not appropriate.
Right, they were
Later on, I
treating
found out. Yeah.
treating something that wasn't there. So now he's
Yeah.
using a walker. He can barely walk. He can't hardly get around. We don't know what happened. What happened, Helen?
What happened? We finally ended up knowing basically and honing in, per the neurologist, that it had to, of all those drugs, because again, when you go into the VA, and I don't know what all he's on, and I wouldn't understand half of it, the names of them, but the point of it is, he went through all the drugs that my husband took, and then neurologist said, okay. He asked some questions, how the side effects, whatever, and he honed it down to 2. I can't say to the public, to anybody, again, because everybody's DNA in their body is different, because everybody takes different medications. I can't sit here and say, this is what's going to cure your Parkinson's, or this is going to cure this, or this is what caused my husband's allergy. My point then and now was, I thought I was going to lose him. I was right there at home, seeing what the pain and everything he was going through, especially with his eyes and everything else. And then when he started falling, I thought, oh my God, you're going to kill one of the cats. Just, no.
He's going to fall on the cat, right?
Well, we just got 2 precious kittens, so I thought, no, it sounds silly.
Yeah.
But,
One-
oh my God, he's got all this metal in his back from all his years of Coast Guard and jumping in the water, saving people, this, that, whatever. And that's another thing. All this stuff was going through my brain. What's going to happen? He could die, or he could just break that. He could break all those.
You mentioned one thing that you were worried about, and that was anaphylactic shock.
Amen.
And I want to spend a couple minutes or more than a couple minutes talking about that, because that can kill you in a matter of minutes.
Can I walk down a quick list?
Sure.
If I may. Anaphylactic shock can affect your airways, your skin, your stomach, or your heart. With your airways, you shortness of breath, breathing difficulties, being able to swallow. For your skin, you might get hives, you might get redness, itchy skin, or swelling. Your stomach, you can get cramps, you can get diarrhea, nausea, and vomiting. And for your heart, you get a drop in blood pressure, an increased heart rate, weak pulse, or feeling faint. So anaphylactic shock doesn't have one thing that shows it.
But,
It can be
yeah.
multiple.
Exactly. But the main thing for people to realize is they might be developing a potential to have an anaphylactic shock. And that shows up like maybe rashes, this, that, sneezing, congestion, nose, stopped up. You might have a bunch of mild symptoms. But then when the anaphylactic takes over, anaphylactic shock is shock per se. Anaphylactics is this. You're dead within a couple minutes. You're
Well,
dead.
Let me give you a real life example from that. Back in the 90s, I was deployed to Honduras. And we get new people like on Thursdays, for a matter of fact. Airplane comes in, all the people come up, and we had a big outdoor place. We sat in that. And then you got the normal briefings about where you're going to be billeted and the general things about the deployment area and that, your do's and don'ts and such. And the one lady from what we call PERSCO, which is a personnel office, was giving a briefing. She's drinking a can of Coca-Cola. She set that can of Coca-Cola down, and while she was talking, a bee had climbed into the lid of that Coca-Cola, and then when she went back up to pick it up, she got stung in the lip.
Oh.
She was highly allergic to bees, and
And she
went
knew it,
in.
though, already.
But she knew it, and she was going into anaphylactic shock. And fortunately, the med tent was right over here. But she was starting, the shortness of breath almost to a point where she almost stopped breathing. We got people over there right away. It can happen that quick.
Yes, amen.
And, in a
Exactly,
matter of minutes,
exactly.
and you said in 5 minutes you can be dead.
Yeah, within 5 minutes. That's why I have to almost, just shake my head when you call the doctor's office and for an appointment, they said on the recording it says, if you have any issues, call 911. Forget it. By the time when you have issues like this, you don't, there's no time for anybody to come and help you unless there's somebody there with an EpiPen, which you all giving, and I just mentioned to you earlier. These EpiPens, let me just tell you a little short story about that. When I was still in Virginia, anyway, I'm a passionate patient advocate, not just in the OR arena, but I read in the news this little boy, 8-year-old boy, and I'll never forget it because I thought, oh my gosh, and I love children. I have grandchildren, but anyway, he went to the secretary in the school. He says, ma'am, and this is all I'm quoting them, I think I might have eaten something with peanuts in it because I don't feel good. Well, at that time, Virginia didn't have nurses everywhere in the school. They had them here and there, and in the better schools, which is sad, but that's what it was. Anyway, this little boy, they called, 911 or whatever, and he died right there in front of the secretary. He did eat something in the cafeteria that had peanuts in it, and he died of anaphylactic shock. The point of it is, too, sometimes we get so involved in things being political. And that time when that happened to that little boy, I went to the governor that time, Governor Allen. I went to his wife, Susan Allen. That was a long time ago, but it still resonates with me because it happens to a lot of people. People I'm saying, how come these schools have a nurse in the school, and how come, these don't? That's not right. So I helped the School Nurse Association that time to get a law passed saying every school in the state of Virginia needs a nurse. They capitulate, but one side capitulated though, and one didn't. Finally ended up, we tried, per the School Nurse Association, and we tried to get one nurse per 500 students. What came out in the law in Virginia was one nurse per 1,000 students. Now, I don't know if you've ever volunteered at a classroom. I couldn't even imagine a nurse taking care of overseeing 1,000 patients. That's another story, but that was political and and I won't even go into why, but that finally happened. And again, that's another issue. If you have to speak up, like there's things on TV I see. If you see it, say it, and get it solved. If you don't talk about things, things don't get solved. And I know it's hard to get hold of legislators, especially. I can tell you many stories about that when I was trying to handle things for my patients. And just last week, I called into Congressman Boss, and I said, okay, it was a good day. My name is Helen M. French, I need to make contact with him. And she says, well, just go on the internet and get, fill this out and this out. Well, I said, that's a joke, ma'am, because you have to be in the district to get to, for them to read it. Because he's in Illinois, and ma'am, you're here in Nevada. And I said, ma'am, what is your name? And she said, what do you mean? I don't have to give you my name. She got all huffy with me. And I said, there's nothing illegal about me getting your first name. Well, and I asked her a couple more times, and please, I need your name. Well, she hung up on me. Well, then, you can ask my husband. I just finished calling this week, sent Congressman Bost, B-O-S-T, out of Illinois' number again. And I got a nice gentleman there, one of his aides, or whoever he was, and I'm not giving out names, and I'm not going to even go into all that, but he did give me his name, and I explained this VA situation. I said, you need to check to see about Illinois. Are they compliant or not? Well, he said, do this, do this. And then he said to me, ma'am, here's a number to call, and tell them your problems. And I said, excuse me, sir, I just called this number. I am talking to you. And you're telling me to call the same number that I just called to tell Congressman Bost, B-O-S-T, what the issue is? They have a big committee there, and I encourage every veteran organization, or even the federal part stuff. Bost is federal. They need to hear the truth. How do you get information? It's like, I even called the FBI about this bill. And they said, well, we don't deal with that. Well, anyway, the point of it is, how do you, it's almost like trying to stop a flood from breaking down a dam or something.
Yeah.
Everybody's just waiting for somebody to do something, and you have to do something. This is life. This is not about
Now,
simple.
I met earlier with you this week, and we talked for, it seemed like hours, which it was. But just a reminder
Sorry.
here, I'm going to throw the slide up here. We're on VTRC on Facebook, and on YouTube it'll be posted later today. It's called VTRC Space,
Amen.
a space, not the word.
I'm glad you're
USA,
bringing this up.
VTRC Space USA. We had a long discussion about National Suicide Prevention Awareness Month.
Amen.
And the discussion was, well, what happens when you call 988 and press 1? And I was given the runaround. And I said, I'm not calling because I'm suicidal or thinking about killing myself. I'm calling because I need information. Because when we had the actual person that was in charge of 988, which back then was 888, whatever it was, 7322, I remember that.
And this was recent, right?
But this was, we called Wednesday this week. as a
No,
matter
I'm
of fact.
saying that it was in effect even up to recently.
Yeah, well, what had happened is that when I interviewed the head of the whole program for the Veterans Crisis Line, they said that everyone on there received this training from Living Works, and we promote Living Works because they do great suicide awareness training and great suicide intervention skills training. And we pointed that out on the show earlier this month, that intervention skills training is very important because you may be the one doing the actual intervention.
Amen.
And because of that, I wanted to check and see if they were doing that, and it ended up, because of COVID, once again, point to COVID, they kind of dropped that requirement and developed their own training, which they didn't have the same training that I'm accustomed to as being a safe talk, suicide awareness training for everyone, and being an assist applied suicide intervention skills training. As being an instructor for both of those, I knew that their caliber of training wasn't up to what assist provided.
Amen.
And
Well-
I hope, and if anybody out there is listening from the Veterans Crisis Line, please get that reinstated, that you all get the assist training to do the intervention in addition to whatever class that the department developed. And I just heard the 2-minute warning here
2-minute
already.
One thing though, when I heard you make those calls about the numbers of this
Yeah,
and
we
this and
called
this.
together.
But that one last person you spoke to said, "I'll get back with you." Did she?
No, well, she did, in a sense. And I got a thing to call back at that number, which I did. And guess what? I got nothing essentially. So since we're down to 2
Sad.
minutes, I'm going to have to go into this other slide here if I can find
Real
it. I
quick,
don't know. Yeah.
If you take nothing away from this show, it's this. Be your own advocate when it comes to the medical care.
Yep.
Read your pill prescriptions, read the do's and don'ts, and take your meds. Do not be afraid to take your medicine because of something that might happen.
Yeah.
Read your labels and do it, but do not take your meds because that's a sure way to die as well.
Okay, and in less than a minute, I need to bring this on here, and it's not going to give me the graphic along with
Chili
it here.
Cookout on October
But
18th. right?
yes,
Hot
and we'll
dog.
just put the flyer up there. For some reason, the mechanical part didn't work there, so I don't know
Be
what's
at
happening there.
Eagles, 310 Pacific Highway, Henderson, Nevada, 83015 on October 18th. That's a Sunday.
Yeah, and we are out of here.
You're out.
Thank you, RJ.
Okay.
Thank you, Helen.
Thank you, guys. I think it was very, very good on your part, anyway, because it is. It was very good.
Okay, and we are.